The health situation in Malawi, it is characterized by shortage of staff. We have a lot of challenges in equipment. The infrastructure is not in good place, adequate enough to support the health services required.
We are faced with a lot of problems as regards to health. One nurse might be in the ward caring for over 100 patients.
Because the previous interventions lacked an aspect of proper coordination. Each development player would come in with a project and undertake a project one corner of the country, and another NGO would do another activity the other side of the country, and that did not guarantee spread of resources in improving the health sector. One of the major roles that VSO is doing is working with the training institutions. We have registered an increase in the number of trainees to almost double.
Despite that increase, we have got the desire to train more nurses, but we don't have enough materials, enough infrastructures, enough lecturers.
Well, Malawi is not different from the rest of the world. But we are saying in the developing countries, we talk about the shortage of health workers. To fill all these gaps, we need to train more nurses. And currently, government is increasing the capacity of the training institution through the SWAP funding.
Salaries are still relatively low in Malawi, so people tend to move out from to where there are greener pastures outside Malawi, where their salaries are much better. However, the government is trying its best to increase the salaries of the health personnel, but still, I think if you compare with other countries, I think it's still relatively low.
The concept of caring of the carers is a very good thing in Malawi. When we are talking about the carers, we are talking about the nurses, the paramedics, the doctors, or people working in the hospitals. If this is left unattended, many Malawians will leave this country, as they are living every day, every year, every month.
And what we need is those people to help this country, to look after their own people. So if the health workers, we would want to train to retain them and help this nation.
We have registered major achievements in the SWAP. Our contributions in the training institutions, particularly the nursing training institutions, has allowed the training institutions to increase their intake of nurses, and that increase is almost doubled.
Before the vessel came, I think we didn't have any doctor here, qualified doctor. We used to refer a lot of patients to central hospitals, which is not the case now, because some of the patients are being managed here because of the qualified doctors we have now.
But because this is a new phenomenon, we are yet to see the full-fledged meaning of this SWAP. But we are very hopeful that if SWAP is taken seriously, I feel we can really see some changes.
There is a high commitment from the development partners, and there is a high political will to support the SWAP program. So the chance that it is going to be successful is very, very high.
mwana wanga kampekesera katandipeza ine nkumati ndiboza kaya kapena ndikulota ati kuta